Hello, my name is Jenna Conkey. I'm with the Global Access to Pain Relief Initiative. We're here in Uganda with the Palliative Care Association of Uganda. And with me I have Rose Kiwanuka, the Executive Director. Hello Rose, how are you?
Hello Jenna, how are you?
I'm excellent. Thank you so much for taking the time to talk to us today.
Thank you too.
So I'm really excited to meet with Rose today because she is the first palliative care nurse in Uganda. And can you tell us a little bit about how you became a palliative care nurse and how the role of the palliative care nurse has evolved over the years in Uganda?
Thank you so much, Jenna, for giving me this opportunity. And I really feel excited to talk about this because as the first Ugandan palliative care nurse, I've seen the developments that we've gone through as regards palliative care service provision in Uganda. What really pushed me to become a palliative care nurse was the suffering I was witnessing on the wards. Patients coming in a lot of pain and we didn't know what to do. The doctors would come and then prescribe injectable morphine, 3 doses, and then after that, no more, and the patients would keep on calling, "Nurse, can you help me?" And we had nothing to offer to them.
And where were you based out of?
I was based in Zambia Hospital, which is one of the mission hospitals, and I was in charge of a cancer ward where a number of female patients would come with the different types of cancers. But then they would come in advanced stage, we didn't know what to do for them, we had no knowledge in pain control. So really when I saw Dr. Anne Merriman controlling these patients' pain and not allowing it to come back, that motivated me so much and I decided to become a palliative care nurse. But there have been a lot of developments since then. Because when I joined palliative care, I was not a prescriber, I could not prescribe medications. It was the doctor, and the doctors didn't have the knowledge to prescribe these medications or to assess the pain. It was kind of a challenge. However, I was lucky that I was working with a doctor who knew these things. That was Dr. Anne Merriman. She trained me on the job, and I started. Later on, I went out to advance in palliative care education, and then I became a prescriber. But since then, a number of nurses have taken on this prescribers course. Reasons being that nurses in Uganda, they are the majority cadres in the healthcare system. Actually, they form 80% of the workers in the healthcare system. And they are the people who are with patients all the time. Therefore, they need these skills to be able to help the patients. And that's what has pushed more nurses to get onto the prescribers course. We had to do a lot of advocacy so that nurses could be allowed to prescribe medications for these palliative care for the palliative care patients. In 2004, a statute came out allowing nurses to become prescribers, and since then, the nurses those who have undertaken palliative care training are really respected and being consulted as palliative care practitioners.
And I don't know if you know, but do you know how many nurse prescribers there currently are in Uganda?
Yes, I definitely know because I've been involved in developing that curriculum for the nurse prescribers. I teach on it. Currently, we have 117 that have graduated. And Hospice Africa Uganda currently is the only institution that is offering this course. And usually they take about 8 people on their course. So we still have a long way to go, but at least we have something on the ground.
Well, thank you. Yeah. Thank you so much for taking the time to talk with us today.
Thank you.
And thank you for joining us. I'm Jenna Conkey, and this is Rose Kiwanuka. We'll see you next time.
Thank you.